Hello and welcome. Today we've got Marina Carew, and today we are going to be discussing how the dentistry industry is falling apart. They're, for an example, telling us use mouthwash, but it causes high blood pressure. And there's so many hidden diseases that come with these treatments, and it's falling apart, and people are walking away. Now, just before we begin, you can subscribe to my Instagram channel at nicholas.veniamin, where you can follow all my daily news reels. Marina, thank you so much for joining me. How are you and what have you been up to?
I'm really well, thank you, Nick. Happy New Year. And I've been learning and walking my dogs and enjoying Christmas with the family and learning stuff to help my pregnant daughter and my little grandson, because I'm realizing how important, well, I've known for a long time how important dental health is for the whole body. And so that's what I've been learning. Never too old to learn. And
Absolutely.
there's so much to learn out there.
I think the older we get, the more important it is to learn. Because
Yeah,
it's
I think you realise the less that you know, you realise that there's so much out that you don't know, and things are changing all the time.
of course, and it's a great investment when the knowledge is an investment in itself, which costs absolutely nothing. And like you say, it all starts in the mouth, the oral. That's is like the heart of all, the beginning of all diseases. And the dentist industry, which we're about to talk about, is they're responsible for a lot of the healths. We've spoken about you know root canals. We've
Yeah.
spoken about so many things like that, and it's falling apart. So, what is your message today? Because I know you've done your homework on this. So, what's your message today? If I may let you just speak to the viewers.
Okay. What I'd like to say to people is that I do research. I've got loads to learn. I was a holistic dentist for many years, and then I was stopped from practicing in 7 years ago, and went through some dark times. But now I'm out of it, and I'm learning what I can to help educate people, because I think the most important thing is that people get educated to look after themselves. You need to do what you can to keep your own health as best as possible, because no one else is going to do it for you. The other dentists and the doctors out there, they're there to help you, but you shouldn't be dependent on them. And so anything that I'm going to say today is just my opinion. It's research that I've done. It's not advice. It's for educational purposes only. So I'm not giving out any advice, but I'm just asking you to have a look at some of the things I'm going to talk about. Do your own research. And if you want to contact me and ask me stuff, that's fine, I can, but I can't give any dental advice. So where I'd like to start with is some of the things that I've come across are mouthwash. Now, I've never been a great big fan of mouthwash, particularly fluoride mouthwash and alcohol mouthwashes. I didn't have them in my practice because I believed that they caused alcohol mouthwashes, very strong alcohol, and could cause cancer. But I came across I came across a biochemist not so long ago who studies nitric oxide. And I knew that in the mouth, in the back of the nose, you have nitric oxide. You have bacteria that form nitric oxide. And when you breathe in through your nose, the hairs in your nose take out some of the particles, and then it warms everything up. And then you have this nitric oxide, which is bactericidal. It kills off some of the bacteria before it gets down into your lungs. But what I didn't realize was that there are a whole load of bacteria that sit in crypts in the back of your tongue. And so they create nitric oxide from nitrites, which are in your saliva. And the nitrites come from when you eat certain foods, say, for instance, leafy green vegetables that have kale in them, something like kale, for instance, and they have nitrates in them. And that gets turned by your body and your digestive system into nitrites. And the nitrites are then recycled by your liver and put into your salivary glands. Now, this is all stuff was pretty new to me. And that it then gets secreted in your saliva. And those nitrites get on the back of your tongue, where you've got these little crypts with bacteria in them. Those nitrites get converted to nitric oxide, which relaxes blood vessels. It relaxes muscles. It also helps with your gastric mucosa. It helps with the nervous system. So they're really important. And what a few studies have shown is that if you use a mouthwash that's bactericidal twice a day, within 7 days, your blood pressure will go up. And you think how many people are using a mouthwash because they think, oh, I've got bad breath, or my dentist has told me I've got gum disease. I'm using this to help. But they're actually making their health worse.
Mm-hmm.
So I would say stop using any mouthwash unless you have an acute condition. And if you have an acute condition, use it for a few days, then get rid of your mouthwash. You'll be saving some money.
Yeah.
And you'll be saving your health. The studies that they did were with some very healthy athletic people. They also say that very healthy athletic people who didn't have any blood pressure issues, ate healthy diets and exercise. And what they found was using this mouthwash, a bactericidal mouthwash, twice a day killed off all the good bacteria as well as the bad ones. And after a week, they developed high blood pressure. And so it negates any exercise that you do. So if you're doing a mouthwash and you're exercising, you're thinking you're being healthy, actually that mouthwash has just negated the exercise that you've done in the day. So you need to be getting rid of the mouthwash, and even essential oils. There's not enough studies to show which essential oils are beneficial in the mouth. I mean, we know that essential oils can be very good, but if they're going to kill off bacteria, you don't want that. So anything that's going to kill off bacteria in your mouth, a general bacteria cleanse is not going to help you at all.
Absolutely.
Sorry, go on.
No.
So we need to have that nitric oxide for your blood vessels, for your digestive system, and for your nervous system.
Mm-hmm.
And you need to have healthy stomach acid, and you need to be having iodine in your diet.
Before we go into what we need to be doing and a few other issues revolving around the dentistry industry, I want to touch on this because I think it's really important people know about this. But when you take mouthwash or anything like that, that's getting rid of bacteria, for an example, but then it causes another illness, like what you said, high blood pressure. And then you've got a high blood pressure problem. So you go to the doctors, they diagnose you with high blood pressure. They will never diagnose a mouthwash. Can you explain that? And then they will give you pills and other things to treat the blood pressure, which then in turn, the pills would cause other side effects. And then so on and so on and so on until your body can't take it anymore. And then you're on your deathbed. Could you please explain that, please?
Well, I think it's the same with dentists. A lot of people go and see a hygienist regularly. They get everything scraped off and cleaned off, and they get told you've got to keep the bacteria away. And they get there's a mouthwash in the UK called Corsadil. It should only be used very short term, but some people use it a bit longer, but it does stain the teeth. That's the good thing about it. It stains the teeth, so you won't want to use it long term. But it kills off all the good bacteria. And then you've got all the things like Listerine, that's got alcohol in it. Listerine do now make a non-alcohol one, but it's got essential oils in it. It's doing the same thing. And it's not only that, you've got all the other ingredients in it that are particularly harmful, that are probably harmful to the body. So, most doctors don't know about this. Most dentists don't know about it. And to be honest, I didn't realize I always thought that you shouldn't use mouthwash, mostly because you could get an oral cancer from using a mouthwash with alcohol in it. And I also didn't agree with fluoride mouthwashes. And that's the other thing. They say that if you're using a fluoride toothpaste, the fluoride toothpaste kills off the good bacteria. So that can be an issue too. So I think if you can get your gut healthy, get your mouth healthy, and you just can clean. I don't really use a toothpaste. I do have one with propolis in it, but I only use it very rarely. Most of the time I use a dry toothbrush, and you can use salt, baking powder. All of that will save you money, but it also save your health.
Now I want to talk about
other thing.
Yeah, sorry. No, I don't want to stop you because you might forget. So you go for it. I've got it written down. Don't worry.
Oh, and the other thing that tongue scraping is very good. They found that if you tongue scrape, that seems to give you a good diversity of bacteria in your mouth. It's all about, everything's got to be in balance. It's like in your gut. You don't want to take antibiotics all the time. So you don't want, a mouthwash is like having antibiotics all the time. So basically, everything's got to be in balance. So you have good bacteria and bad bacteria, and the good bacteria keep the bad ones in check. If you try and get rid of all the bad bacteria, then you'll take out some of the good bacteria, and then some of the ones that weren't so bad can take over and become really bad.
Interesting. Now, I was actually advised by my dentist to take mouthwash, and I said no. I said there's chemical. I did it, to be honest with you. It's not my area of expertise, but I do know that there's chemicals in there.
Yeah.
And I said that I don't like chemicals. I like natural remedies because then it causes other issues. And
Yes.
she actually sort of agreed with me. She gave me the impression that she's doing her job, but she agreed with me. And I think, maybe gargling your mouth with a bit of water and apple cider vinegar might do the job too. I think apple cider vinegar is great. What do you think about that?
Well, I think apple cider vinegar is very good to get your stomach acid going. I'm not sure about the acidity with the enamel, although, there are people that say if you have a lot of acidic stuff, you'll get, your enamel will start to erode. Although I have seen that very rarely in dental practice, but from personal experience, I haven't seen it because I have a lot of kombucha, and kombucha is quite acidic.
As I said, I don't know. This is just what I think. I know apple cider vinegar's got many health benefits.
Yes,
And I
yes,
like that. What my point here is, I like the natural root of this. I don't
yes,
like these chemical, flavored things that you can buy from Walmart, or you can buy
yeah.
from Publix or Tesco's. Over here, we've got Tesco's and Sainsbury's, all these big, massive supermarket chains that are controlled by the deep state, when God has given this to us organically and we can make it at home.
Yeah, but we didn't have all this stuff years ago. We didn't have all of this years ago, and people kept their teeth longer, but because they had different diets. They had, they had different diets. They didn't have as many toxins around, because the toxins affect the way your teeth develop and can be harmful to the oral cavity. So, life has changed, and I think our bodies are subjected to so much more with EMFs and LED lights and, all sorts of things. So our immune systems do not work as well as they probably did years ago.
Marina, I have to say that I feel like now, let's say you want to treat something, it
Mm-hmm.
treats it, it does the job, but
Yeah,
there's a compromise. You get ill, or it causes you to get high blood pressure, for an example,
absolutely.
or the fluoride. It might be really good cleaning your teeth. I don't know, but there's a trade-off. It's really bad. It
Yes.
causes Alzheimer's. It causes brain tumors. Some say it causes your intuition to close
It
down.
calcifies your pineal gland. And sorry, I've just got to plug my phone in. It calcifies your pineal gland, and your pineal gland is where melatonin is produced. It's also produced in mitochondria, but your pineal gland is your connection to your higher self. And so fluoride actually calcifies your pineal gland,
Absolutely. And this is
which
what
is
they
not
don't
good.
want. Well, they don't want
No,
us
they don't
to.
want us to have that connection to our higher self.
And this is why they've got the chemicals in everything we do. And obviously, with the whole lifestyle thing, now it's very hard to eat organic. It's very hard now to go to a farm, go somewhere clean and get your clean eggs and meats and vegetables. Now everything is restaurants and everything's processed, everything's GMO.
Yes,
It's
yes.
terrible. We need to find ways how to obviously, remove this from our body. And I want to say that a lot of doctors, because I know you want to speak about this, a lot of doctors are waking up. They're talking about this. You're saying that the NHS and the dental industry do not have the funding. What do you have to say about that?
Well, I didn't do dent. I left the NHS many years ago because I learned about amalgams. And if I'd stayed in the NHS, I would have had to put amalgams in. So I couldn't do that because I wouldn't have one in my mouth again. So I decided. So All I know is that people are finding it very, very difficult to get hold of an NHS dentist because I'm on Facebook pages and I see people complaining they're in pain, their kids are in pain, and they can't get any treatment. And I think that's absolutely appalling, especially to leave a little child in pain, or, you know, even an adult in pain. And then if they do go and see someone, they get written a prescription for antibiotics. And it's like, well, when I was a dental student, and a lot of my colleagues who are the same age as me, we were taught you don't just write a prescription out, you deal with the problem. The only time you write a prescription if someone's got a swollen face or they've had surgery, but nowadays they seem to write prescriptions out for everything. Everything, have an antibiotic, but also people expect it. But the antibiotics are just like a nuclear bomb in your gut, and they'll kill off all the good bacteria too. So, you know, that's how the NHS is treating people. I think some private dentists as well. I had to go and see a dentist because I needed a tooth taking out. And the dentist, who was an oral surgeon, said to me, "Oh, I'll give you some antibiotics." And I said, "What for?" And she said, "Oh, because it's a routine thing." And I said, "No." And I refused to allow her to treat me, because I thought anybody that writes out a prescription because they can earn a bit of money from doing that, but actually doesn't give someone something they don't need, I don't want to see them. But this is what's happening all the time. People do not know, and they think they need that. That you go and see a dentist and the dentist says you need antibiotics. People don't question it.
No, but like I said, there's a trade-off. So it does what it needs to do, but then it gets rid of the good bacteria in your body. Like, there's a trade-off.
But if you, I mean, like for me, I needed a tooth taking out. There was absolutely no indication to give me antibiotics. I wasn't in pain. I didn't have any swelling. So there was no reason to have antibiotics. So I went to see another dentist. He didn't even suggest antibiotics. Took my tooth out and it was fine.
Absolutely. So the funding business. So why do you say there's no funding?
Well, many years ago, they changed the contract with dentists, and there isn't a lot of funding for it. It's very, very poorly funded. And the dentists just have to see patients as quickly as possible, use the cheapest materials, use the cheapest labs to do the work, because they won't make any money otherwise. They have to pay for their own staff, they have to pay for the building, they have to pay for their insurance, they have to pay for continuing professional development. It's a very expensive business being a dentist, because everything in dentistry is incredibly expensive material-wise. And so if you're working as an NHS dentist, you have an NHS contract, and so you have to rush through the patients as quickly as possible.
Absolutely. Do you think there are more people?
Who gets a good service?
Do you think there are more people leaving the dentist industry now? They're waking up. They're going to more the holistic way.
I think there's a lot of people thinking, I've got to be careful what I say here, but I think there's a lot of dentists who are saying they're going down the holistic route, because I've been asked by a number of people, "Oh, is this dentist holistic?" And I go and have a look at the website and they say, "Oh, yes, we do this stuff and that stuff. We're holistic." And then you look a bit deeper and they're putting Botox in. And to my mind, how can that be holistic? I think they're jumping on the bandwagon because a lot of people are now choosing. Loads of people say to me, "I want a holistic dentist." I actually met a dentist when I went to a shop to buy some essential oils, and the girl working behind the till was actually a dentist, and she'd left the profession because she did work in a holistic practice, but it was all about money. And so she said,
yeah.
"I don't want to be a dentist anymore." And this was a holistic practice, a practice that I've known of for years. And she said it was all about money. There wasn't really any patient care, and it was all about telling the patients, you need to have all your amalgams taken out, you need to have all your root fillings taken out, you need to have all your cavitations done. And I've also met two people who've been to see holistic dentists and have been given massive treatment plans. One of them was given a treatment plan of about £60,000. And on the treatment plan, she showed me, the dentist had written, she had about 6 root treatments, and the dentist had written that 5 was satisfactory, one was unsatisfactory, but the treatment plan was to take them all out. Now, I know that root treatments are not particularly good for you, but they having everything done it's like you say, it is a trade-off. Do you keep a tooth with a root treatment in that appears to be okay and your health appears to be okay, or do you just have it all taken out? And I met another lady. I haven't met her, but I've spoken to her, and I'm going to meet her in Germany on Sunday. She went to a clinic in Switzerland. She had all her amalgams taken out, all her root filled teeth taken out, and all her cavitations removed. Now, this is a very experienced clinic in Switzerland that specializes in all of this, and she's incredibly sick now.
Wow, that's very sad to hear. It's so important to take care of our health, and we're running out of time. But I want to
Absolutely.
quickly cover this.
Sorry.
Just before we finish, what do you think we can do? Home remedies and other things to mitigate these issues.
Right. Stop using mouthwash. Stop using a fluoride toothpaste. You don't really need to use a fluoride toothpaste. Get your gut as healthy as possible. Eat organic food if you can, even though, I believe that the rain falls on it and it's still probably a bit contaminated. Try and eat as whole foods as you can, many whole foods as you can. Avoid processed foods. Chew, 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 because chewing develops your muscles. Sleep apnea is a big problem where the jaws haven't developed properly. And you need to get that addressed. If you have a problem with that, find a dentist that understands about sleep apnea. Do not accept that if you grind your teeth, you should just have mouth guards made. That is just putting a plaster on it. I mean, there's so much that I could say about all of this. But the other thing is I'm learning that babies, when they're in the mother's womb, they get a lot of PFAs. PFAs are polyfluoroalkyls or perfluoroalkyls. They come from, and they're in the water a lot of the time. Most of the water was contaminated in the UK with that, and they can cause developmental defects. They don't know how yet, but in the West Virginia University, they found they cause defects, not defects, but problems with the formation of the teeth in the womb. And so the teeth then become more susceptible to caries. And I've heard that in England, the most common reason for a child being admitted into hospital is through tooth decay between the ages of 6 and 10. That is terrible. So we need to be avoiding sugar. We need to be cleaning our water, have the cleanest water possible, and detox as best you can. Just, detox. And I take root products to detox. I think they have helped me enormously. They've given me my life back, and they've also made me discover what I need to know to help other people. And I think taking some really good, you've got to get really, really clean water. That's the most important thing. Tongue scraping, use a soft toothbrush, and detox.
Absolutely. Well, I will leave the link below for that root thing if that you mentioned. Thank you so much. And obviously everything else that you mentioned, definitely there you can do them at home. Well, thank you very much, Marina, and we'll speak again very soon. You take care and Happy
Yes,
New
and if
Year.
anybody wants to contact me, I can do, and I can tell them about how they can help detox themselves. You've got to invest in your own health, because if you don't, no one else will.
Absolutely. I'll leave that below, your contact details as well below, because last time you had a lot of questions and you gladly helped many people. You're not alone. So I say to the viewers, you're not alone. We're in this together and we're here to
Yes.
help. So please reach out to Marina. And, we're lucky we have her. And thank you so much, Marina. And Happy New Year to
Thank
you.
you for having me.
And we'll speak again soon. Take care. Bye-bye.
Yeah. Take care. Bye.